If you have hypothyroidism or you take medication for your thyroid, you really should watch this video. You're going to get a lot of information that explains how your medications work and why they may not be working well for you. So we're talking about medication and how your body is going to use that. So let's just start with just the medication itself. I have a couple props here. So I drew these out. So when we're talking about how your thyroid is going to work, at the top here we have TSH. TSH is coming from your pituitary gland in your head, and it goes down to the thyroid and tells it to make a hormone called T4. Now your medication might also be a form of T4, like levothyroxine, Synthroid. This is what this is. It's T4. And then what needs to happen is you need to take that T4 and you have to turn it into the active form of thyroid hormone, which is T3. Okay? Really, we call T4 a prohormone because it's a hormone that needs to be turned into a different hormone. In this case, it's T3. So we talk about T4 and T3. So let's just kind of explain what that means. So T4 means that you have this hormone and it has 4 pieces or molecules of iodine in it, okay? And then you have an enzyme system that has to come in here and turn it from 4 iodine to 3 iodine, and that's your T3. So you need to take one off so you have 3, okay? So one of the problems we run into when people are receiving medication for their thyroid is they're looking at a couple different tests. So one of them is, okay, the TSH. Many times it's just the TSH and just the T4 that's being looked at. And the TSH is just telling us what your pituitary thinks of the situation and how your pituitary is using that hormone. I'm going to go into that in just a little bit more here on what's going on with the pituitary and TSH. But many times all it's being measured is the TSH, which is just what your pituitary thinks of the hormone level, and then the T4, which your thyroid may be making or may not be making if you don't have a thyroid gland, or the T4 is also the medication. So you may just be measuring what the pituitary thinks and measuring the medication that you're taking, or just the T4 that's being produced by the thyroid. The whole point is we have to get this T4 and we have to get it turned here into T3, into this active form. And that's accomplished by enzymes. So you're going to see some enzymes right through here, and we'll just keep it really simple. We'll just call them D, 1, 2, and 3. Now we call them D because they are deiodinases, and what that means is it takes that 4 iodines and turns it into 3. Okay, then you have your active T3. So here are enzymes here that we talked about, and again it's turning T4 into T3. But we have 3 different enzymes. We have D1 and D2 and D3. So D1 is what's mainly occurring throughout your body. Okay, this enzyme is taking either your medication or the T4 your thyroid is making and turning it into T3. Now your pituitary has a different D. It has a D2. So it's a different enzyme than the rest of the body. So this is where we start running into some problems because your pituitary might have a really good D2 enzyme system and it's taking your medication or taking the T4 that's being produced by your thyroid and turning it into T3 very well. But the enzyme system that does it for all of the rest of your body, which is what you're actually measuring in the bloodstream, may not be working so well. So we can get a breakdown of this enzyme system. This one can be working pretty well, and then what's going to happen is your TSH is going to look fine, your T4 is going to look fine, and you're going to be told everything's fine, but you know everything isn't fine because you're still having symptoms of low thyroid function. Maybe you're still fatigued, or you have poor digestion, or constipation, or muscle aches, or depression, or weight gain, or hair loss. Again, we're missing the whole system here because you have to look at these different enzymes. Then there's a third one down here, and what that'll do is that'll take your T4 and it'll turn it into a different kind of T3. We call that reverse T3 here, which is, we kind of call it a junk form of T3 because what it does is it gets in the way of your good functioning T3. So you have these different enzymes that are going to have a huge impact on your lab test results and how you're feeling, which is why we can't just rely on looking at the level of the T4 or just looking at the level of the TSH, because the TSH is just what your pituitary is doing. It's not what's happening throughout the rest of your body. So I know I went through some pretty big concepts here. If you'd like some more information on this, you should really check out the blog because I break it down in much more detail, and I will talk about some of the things that would influence your ability to use and convert that enzyme, the hormone, from T4 to T3. And this has been a problem that I've seen for years, okay? And I've worked with patients on this to try to help explain to them what's happening, and tried to work with other doctors with this. And I said, that's it. We're going to just solve this problem ourselves within our office. And so I'm partnering with a good friend of mine, a medical doctor who also practices functional medicine. And he'll be able to start helping our patients if they're having problems with their thyroid medication. He also works with bioidentical hormones, working with estrogen, progesterone, testosterone. So again, this really goes back to the whole concept of this functional medicine perspective. And the whole idea is finding out what's not functioning, and we work to get it functioning. But in some cases, we need to support the body with certain things it's not able to make for whatever reason. So in Hashimoto's, maybe you've had so much destruction of the thyroid that to have proper function, you do require medication, but you have to be on the right kind of medication and be on the right dose of medication to optimize what's happening in your body. Same with other hormones, estrogen, progesterone, testosterone. You need them, okay? You need these in your system, but if we're having a problem with the ovaries, or you no longer have ovaries, or there's other factors where, look, we're just not going to get those hormones, we have to step in and provide those in the most natural and beneficial form that we can. So I hope you found this video enlightening. Again, check out the blog for more details and specifics about the hormone and the converting of the hormone. If you really look at this, you're going to know more about your thyroid than most of the doctors out there. So again, hope you enjoyed this. Thank you.